Good day, class. In the previous video, we have introduced the general introduction of the exterior releasing herbs. So from the study, we will understand what are in common in this group of herbs. And from this video, we are going to discuss the specific herbs. From the study in the general introduction, we knew that there are about 500 different kinds of herbs that are commonly used in the clinical practice. We are not going to introduce all of them, we're only going to introduce some of them. And from the discussion in these few videos, we try to show you how to analyze the actions from their natures and flavors. What are the relationship between or among the natures, flavors, and actions? How to understand or how to get to know the actions from their flavors or from their natures. After the study, you may be able to analyze some other systems from their nature and from their flavors. So we're going to discuss in these two categories: wind cold dispersing herbs and wind heat dispersing herbs. Wind cold dispersing herbs. From the title, you will understand that the patient suffer from wind, suffer from cold, and we try to use the herbs to disperse or to dispel. So the patient suffer from cold, we need to use something warm to relieve the coldness. We're going to use pungent to relieve the wind. So what happened to the patient is wind cold, the wind cold attack. And the property of these herbs, most of them are pungent and warm. That's why they have the function to dispel the cold and dispel the wind. And these herbs can be used to relieve the exterior wind syndrome due to wind cold. Most of them are pungent and warm. Apart from these common characteristics, some of them have the function of stopping coughing, drying dampness, inducing diuresis, stopping itching or stopping pain. So there's some of them, but most of them can dispel wind cold. The first herb we're going to introduce is Mahuang. Mahuang is quite a famous herb. When we study the materia medica, the first herb we're going to introduce is Mahuang. In future, when we study the formula, the first formula we're going to study is Mahuang Tang, it's Mahuang decoction. Mahuang also have been used for a very long time. The Mahuang decoction was from the classic Sanghan Run, so it was about 1,800 years ago. The property of Mahuang: pungent, slightly bitter, warm, lung and bladder meridian entered. The more we study, the more properties you will have. How to remember the properties? As long as you can remember, Mahuang is in the category of wind cold dispersing herb. So this group of herbs has the properties of pungent, warm, lung and bladder meridian entered. So you can see from the previous slides, pungent, warm, lung and bladder meridian entered. So when you study Mahuang, all what you need to remember is slightly bitter. Slightly bitter is the specific property of Mahuang, and then you add on the common characteristics of this group of herbs, which are pungent, warm, lung and bladder meridian entered. So these are the natures, the taste, the flavors, and also the meridian tropism. That's something we need to remember. The actions of Mahuang induce sweating, release bacteria, relieve tachypnea, and alleviates cough, promotes urination. Indications: when causes bacterial excess syndrome, coughing, tachypnea, edema. Dosage: 3 to 10 grams used in decoction. It is prohibited to be used for patients with deficient tachypnea without blockage of the lung qi. Deficient, the patient will, so Mahuang must be used in an excess syndrome, not in a deficient syndrome. Not only tachypnea, as long as deficient, we don't use Mahuang. So that's very important to understand the excess syndrome. What kind of syndrome considered as excess syndrome? For example, you can feel from the pulse, a weak pulse or a forceful pulse. Also from the patient's constitution, the patient is strong or weak. The patient feels tired or still energetic. So these are something you can think about, you can consider. The nature of Mahuang is warm. So because of warm, it can be used in a cold syndrome. So it can dispel the wind cold. We can use in a wind cold syndrome or wind cold symptoms. For example, the patient suffers from aversion to cold, runny nose, itching skin, nasal blockage, especially with coughing or tachypnea. So these are the wind cold symptoms or wind cold syndrome. Mahuang also pungent. Pungent can disperse the lung qi. So when you disperse, it can result in sweating. It can stop coughing to regulate the lung qi, to improve urination. While the open the lungs can improve the urination. This is very similar to open the lung. It's very similar in a pot. When you pour the water from a pot, a normal pot, if you want to pour the water out of pot, in the pots, each pot they will have a hole here, right? When you see the pot, let's make it easier to pour the water out from the pot. Similar to our body, the water want to go out, there must be a hole here. If you close this hole, you will create a negative pressure in the pot, so the water won't come out that easy. This is very similar. If our lung sits on top of our human body, the lung sits on top of the body. If the lung is closed, it will cause the difficult urination. In this situation, we will open the lungs to improve the urination. And also, Mahuang is very light. It can go to upper jaw. It can enter the lung. That's why it's lung and bladder meridian entered. So we can use for patients suffer from wind cold, especially in the exterior syndrome, exterior area, and also can be used for itching skin, can be used for nasal blockage. That's all exterior wind cold symptoms. We also can use Mahuang in the skin disorder, the itching skin due to the wind. So the itching skin, why we can use for itching skin? Because the lung is related to the skin. Also, the itching is related to the wind. Because the Mahuang can dispel the wind, that's why it can use for itching skin. If this itching skin is not due to wind, then you may still use Mahuang, but you must add something else for the cause of itching skin. For example, in blood deficiency, then you need to add something to nourish the blood, and then you add Mahuang to reduce the wind. When we use Mahuang to dispel the wind cold, we can add Guizhi. Guizhi is the second herb that we going to introduce after Mahuang. After the discussion, you will understand because of these natures and flavors, Mahuang can be used in a wind cold syndrome. Especially wind cold excessive syndrome, the patient may present with wind cold symptoms and without sweating. And in this situation, we may add Guizhi to assist Mahuang. Mahuang also can be used in coughing, tachypnea. In this situation, we may add Guxinren, the bitter almond seeds, to assist Mahuang to relieve the coughing and tachypnea. Mahuang also can be used in edema, difficult urination. The reason is because Mahuang can open the lungs. Mahuang is pungent, can open the lungs and can cause sweating and improve urination. Sweating and the increased urination may result in to relieve the water retention in the body. That's how to assist the edema. Especially when a patient suffers from edema and tachypnea and coughing. The patient suffers from edema and accompanied by coughing and tachypnea. Even with a runny nose, aversion to cold, the Mahuang is most suitable to be used in this situation. Mahuang is not suitable to be used in a patient with spontaneous sweating that's due to deficiency. Also, the tachypnea or coughing due to lung qi deficiency or kidney qi deficiency, Mahuang also not suitable to be used.